Tom, thank you. Protection could be on its way for Arkansas's youngest kids. Today, Moderna asked the FDA for emergency use authorization for its COVID-19 vaccine for babies, toddlers, and preschoolers. THV11's Mercedes McKay spoke with doctors here about the questions parents still have.
The waiting game may be almost over for parents of young kids.
I had a checkup with a 15-month-old baby 30 seconds before I talked to you, and that was their question. How about the COVID vaccine?
As a pediatrician at All for Kids Pediatric Clinic, Dr. Jerry Byram is answering that question a lot.
Parents are going to be nervous with any kind of delay. They want things to they want everything to line up. But rarely in medicine do things line up, particularly with kids.
But things could be lining up soon as Moderna seeks approval for what could be the first shot for children under 5. And doctors say it's coming at a good time.
Everyone needs to be protected from this disease. And these young kids are in daycare. And unfortunately, here recently, we've had a lot of daycare spread of COVID-19.
I reached out and asked several parents, and none of them wanted to talk about the subject of getting their young kids vaccinated. So I came here to Kavanaugh Pharmacy, and the owner told me that the biggest question she keeps getting from parents is, why is this taking so long?
Why is it taking so long? Because we're trying to make sure that it is effective for our children, and so we want it to take a long time.
Even though it may be frustrating, Ann Pace wants parents to understand that the back and forth is a good thing, not only for their kids, but for the community.
As we continue to have this virus mutate, we don't know if the next strain is going to hit kids harder than the previous strains have. And so it can still be problematic for anyone.
While parents may still have questions and the shot isn't official yet, both Dr. Byram and Pace say most parents have already made up their mind.
I'm not making much headway on convincing people to do it, but there are people that are ready for it, and there are people that are very entrenched against it.
Parents have decided at this point whether they want to vaccinate their child or not, and so we're not here to change that decision for them.
Mercedes McKay, THV 11 News.
Mercedes, thank you. When and if it gets approved, Pace says her pharmacy and others are ready to step into the role of distributing the shots. The FDA is expected to make a final decision for the kid-sized shot by June.